Hi, I think we are live. Yeah. Good afternoon. It's about 2 o'clock now. Let's start. I think our audience is quite quiet, but I prepared this so that you can see at your free time also. Today we're going to talk about um, a very important topic on heart attack and stroke. No, not too detailed, but you need to know why we need to know it and then how to prevent it. Huh? So, okay, we will start so that you can share it with your friends. Huh? The slide, some of it is in Mandarin. I have translated a big part of it, but this one is actually just say this is a silent killer. Silent killer means they kill you without you knowing. Huh? Silent killer then is actually pointing towards heart attack, stroke, something to do with circulation. So we want to know stroke and heart attack. Who do they affect? So I'm choosing this because we know them quite well. So this is Elizabeth Taylor. Oh, she has a heart attack. This is Tony Braxton, Bill Clinton. This is the singer. Oh, had a heart attack problem when he's still young. I mean, she's still young, about 30 something. Oh, this is a famous Hong Kong actor. He died at 60 something years old. He used to work with Stephen Chow doing comedy. If you are into Stephen Chow movie. This is Larry King, the famous TV presenter. Robin Williams, the late Robin Williams. This is also Chinese actor, Hong Kong actor. No. So you see that the age also varies from the very young to the very old. Everyone have this problem. To the one who exercise every day. Do you watch the Biggest Loser in the US? The Biggest Loser, the program that promote weight loss. And then this is the trainer. He himself had heart attack, even though he's very fit and he's even a trainer. No? This is Cameroon striker, not a striker, Cameroon football player. He collapsed in the field when he was only about 28 to 30 years old. Collapsed and died. So it affects everyone, whether you think that you are healthy or whether you are exercising every day or anyone at all. So you want to know why it happens. So why we cannot ignore this? You see, a lot of people think that problem with heart attack or stroke, it only affects the very old, or at least 50 years old, 60 years old. But we found out that 3H means 3 high. We means high blood sugar, high cholesterol, or high blood pressure. So it's called 3H, 3 high. You don't have to get all 3 high, you just have to have one, then you're qualified. So younger than 40 years old, hospitalization due to blood pressure, sugar, or cholesterol high, 41% of them is actually less than 40 years old. That means young but have this problem, either one of them as well. And then you will notice that 25% of the death in the hospital is due to this problem, and they are all younger than 60 years old. Younger than 60 years old and die of diabetes, die of high blood pressure, or die of high cholesterol. Oh. So do you have these symptoms? So because the effect uh, is devastating, so we need to know the early signs so that we can do the necessary thing to prevent them. So if you know that you have headache, dizziness, this could be the early signs that you need to take care. Headache, usually we just take Panadol and then forget about it. But it could be the sign that the circulation start to have some problem. So we need to probably go and have a check. And if it is persistent, definitely we will need to check. It can be sign of a high blood pressure, can be sign of a sticky blood causing the blood not going up to the brain. Or even if just one reading that is normal does not exclude that you have problem with that. Always thirsty, or you look pale, ashen complexion, look like ash, like dark, or there's no brightness in the complexion. Or with the heart, some people complain of discomfort, pain, or you have body ache everywhere, even just mild body ache. Just close the door. Or some people have insomnia, cannot sleep at night, or anxiety attack, or feeling depressed. They could be the sign also. Or if you are overweight, or you have unexplained weight loss despite very good appetite, this can be the early signs. Or you are feeling extremely fatigued for your age, or you just feel like you don't want to move. These are the early symptoms of stroke. Or you're going to have 3 high, which is going to lead to stroke or heart attack. Okay, so is this your lifestyle? We just have a do a short evaluation of ourselves. So are we not taking enough vegetable and fruits, too much meat and rice, or are we taking them at the wrong time? Or we are skipping breakfast. A lot of us are doing that, so it's very very bad for the stomach. Oh, and then it's very very bad for the digestion. So when your digestion is affected, it's easy for you to accumulate a lot of sugar and fat, rather than getting all the nutrients that you need. So if you eat late, supper, or your dinner is very very late at night, then you don't give your body the opportunity to digest them properly, so it will turn into fat also, or and cholesterol. So in the second category is rest. Are we overwork? Or a lot of us, if the criteria is that if you need to work overtime twice a week, then it's considered quite a lot. If we sleep late, sleep later than 11 p.m., it will affect us. As our liver do not have enough rest, then it cannot excrete the fat cholesterol from the body. Or are we exercising less than 3 times a week? Or even when we do exercise, we only do for a very short period, or because we feel too fatigued to do it. Emotion, are we bad-tempered, highly stressed life? So these are the things that can cause you to have high blood sugar, hypertension, which is a high blood pressure, and high cholesterol. So detecting the silent killer. So high blood pressure, high cholesterol, diabetes. So is our blood vessel healthy? You will see this. This is the normal one, the first one, the normal one. But as we age, it tends to accumulate a lot of fat and sugar. It coat and make the blood vessel very very small. You can imagine this is a normal blood pressure here, but as it got narrower and narrower, it's totally occluded here. So there is no blood passing through. So the 3 key reasons we need to remember today for unhealthy blood and blood vessels is this: the blood is too sticky. When you check, there's a lot of fat, a lot of sugar inside, so it's very sticky, it's not moving well. The second thing is, as we age, the arteries becomes very stiff. This is a normal process, but if you have high blood sugar, high cholesterol, high blood pressure, then the stiffness of the artery, the blood vessel, become faster. So we grow old faster. Harvard University has stated that your real age, it depends on the age of your blood vessels. So the 3S: one is sticky blood, 2 stiff artery, the third one stuck with blood clots and impurity like cholesterol and sugar. So why do we need to take this seriously? Because high incidence, 51% mortality is because of these three high, high cholesterol, high blood pressure, and high sugar or diabetes. Mortality means die. 51% of mortality die. Or 20% of the population have a 3 high patient. So it's a lot. This is in China. So mortality in China, every hour, this high blood pressure, high sugar, high cholesterol kills 260 person per hour. So that's a lot. And even if you do recover from the attack, a lot of people have relapsed. Means you have the same problem again. Like a lot of people think that I have stroke or heart attack, then I won't be so unlucky to get it second time. But we are wrong. Once you get this first time, then it's very easy to get a second time, unless you do the right thing. Okay. So recurrence in the first year is about 30%, and the second year is even higher, 59%. So we have seen a lot of patients who have stroke this year, and then end of the year they get another one, and then the third time they get it. Each time it get worse. So unless you do something about it to reverse this unhealthy body, you're going to get the recurrence. Very high percentage of them do get that. It's a life burden. Once someone have stroke or heart attack, 75% bedridden, 40% lose ability to earn money for the family. Instead, you will be a burden to the family because they will need to find money to find helper. They will have to work to feed the family. So we have to take this very, very seriously. So of course, it all first started with abnormal sugar, abnormal blood pressure, abnormal cholesterol, but it soon becomes stroke and heart attack, complications. So the complication of the diabetes, stroke, blindness, nerve dysfunction, numbness in the hands or legs, cannot feel anything, very late in recovery from illness, or heart attack, kidney problems, bone and ligament problem, diabetic foot needing amputation. These are the things that none of us wish to happen to us. Okay, so how to treat this? First of all, you need to know you need to be educated. Hence, the reason for this video. Second, you need to take care of your diet because of this three high. It's because of what we take mostly. We need to exercise because we eat a lot. We need to excrete whatever that is not used in the body. We need to have a body checkup because you never know. A lot of people, when I ask them, do you have high blood pressure? They say, we don't know. Or they will say they don't have, but they have never checked it before. So if you never check it, then you will never know you have it, or until you have stroke or high blood pressure, or suddenly you go to the hospital with a chest pain, or you need amputation in the leg. So that's very late. It sounds it sounds funny, but it's really it happens in the hospital, or often to me anyway. Also, you need to take medicine if you are deemed to have high blood pressure or high sugar, high cholesterol to control it, or to avoid heart attack and stroke. So daily sugar intake should be less than 6 grams. Cut down sugary drinks, sugary food, any carbohydrate like rice, cake, or biscuits, anything that is addictive, like 3-in-1 coffee, or all the fast food. They are high in sugar actually. So we should not drink all these things. So this one is about the normal size of what we should take. Your main meal should be one feast like this, and then the meat is about this big. The fat should be only this much, and then the vegetable should be this much. When you're with both of your palm. So we talk about healthy oil. Even if we avoid all oil, it's not healthy also. We talk about omega-6 to omega-3 ratio. We'll talk about this more later on, but we found out that those who have a good ratio of this, they are less likely to have stroke or heart attack. So the ideal ratio is 4 omega-6 to omega-3 is 4 to 1. So that means 4 parts of 6 and then 1 part of omega-3. Unfortunately, most of us have this ratio 15 to 1. That is why we have a lot of people with a with stroke and heart attack. Okay, so omega-6, what do we have? Omega-6 are found in nuts, in meat mostly, in all these highly refined oil. They have that omega-6, and omega-3 are mostly found in deep sea fish, like a salmon, tuna, seal. We always found them in deep sea creatures, and some vegetables and some eggs. They are fortified with omega-3. So we need to take a lot of omega-3 to balance this ratio, because most of us are eating a lot of meat anyway. So omega-6 is very, very high. So the omega-3 is you have, some of you will be familiar with EPA, DHA, and DPA. So we won't go too deep into this. They all have their own function. All these 3 components of the omega-3, mostly it benefits the eye, the brain, the skin, and your hormone. So it's very good. It's important, in fact, for the whole, all over the body. It also clears your cholesterol in the body when you are taking in correct dose, enough dose. So just now we are talking about the 3S. If you still remember, sticky blood, or stuck blood clot, and the stiff artery. So we need to know how to treat this. So we have this, we are going to introduce to you this B circulation aid. It increase the flow and dissolve the clot. We will see what component do that. It also soften the blood vessel so that we become younger. It also cleans the blood and cholesterol. So this one thing do all these three. So of course, if you have high sugar, you should add in glucoate to clean your blood and cholesterol. And then this poor tea, it clean your blood and your cholesterol, depending on your preference. Oh, if you want a very fast result, you can take all at once. So what does it do? Well, this one is the BCA, B circulation aid. So it has this we call salvia, panas noto ginseng, alisma, and hawthorn. I think I'll do a video to talk about the component. So what does this do? This one helps regulate the blood viscosity. So it make your sticky blood less sticky, improve the blood flow. So the second one, because as we age, our blood vessel also becomes stiff. When it becomes stiff, it cannot expand. So what happens is blood pressure very high. And in this also, when the blood vessel is stiff, it can damage the organs that it supplies to, for example, the liver, the kidney. So it softens and repair the blood vessels. So we use ginkgo biloba extract. This one is very good for the blood vessels all over the body and especially in the brain also. Then the next thing, the one that clean the blood is this perilla oil. We are using it as the omega-3. It lowers cholesterol, triglyceride level. It also clean up our blood from cholesterol. This product itself is also very good for gout. It clear out the uric acid. So this is the Chinese version. We will skip that. I'll do a video on this later on. There's a separate video for diabetes, so you can read on that. Yes. I think if there's any question, you can ask. Otherwise, you can use this as a reference to start you off. Just remember, you cannot ignore blood pressure, you cannot ignore high sugar, you cannot ignore cholesterol. Okay, so if you are taking hospital medicine, you need to take it, and then you need to have a follow-up in the hospital properly. Otherwise, this medication might give you side effects. But if you are choosing to use this medicine, it's safer. You don't need to follow up, but you will still need to check your blood pressure is it within reasonable level. If it is still very high, then you will need to use hospital medicine to control. At the same time, improve your blood vessel so that you have a chance to off the medicine. If you have any question, you can ask. You can leave a message in the YouTube, or you can message me through WhatsApp or WeChat. I will find time to answer your question. Okay, that's all for today. Thank you very much.